Hi Dr. Starr, I am beginning my community nursing rotation next week. In my hometown we have a growing Hispanic population. I am excited to take care of this demographic area, but unfortunately I do not know how to speak any Spanish. Do you have any recommendations on how I can best provide care for these patients?
Jonathan, I'm so glad you asked me that question. Community health is so important and oftentimes becomes a low priority in nursing school. The Hispanic population is growing and readmission rates are at an all-time high. Doctors and nurses are in such a rush, and those that do not speak English do not get adequate discharge instructions. There is lots of services that can be used in the home care setting for these patients.
Thank you for taking the time to meet with me. What do you suggest I do next?
I want to give you a list of resources you can use. The use of online is a beautiful way to become culturally competent and find resources available. I have a list that I can provide you with the most up-to-date useful information available. Jonathan & Company here are very useful websites you can browse. The visiting nurse facility that you may use should have a contract with agencies such as LanguageLine to provide three-way communication. This is the best and most effective way to communicate with patients. Things to consider: does the patient have a working phone, preferably that is speakerphone? If not, the nurse should have one provided by the company. Second, can the patient hear well? Is the patient confused? Third, depending on certain scenarios you may need to arrange for a family member or friend that speaks English to be present.
Thank you, Dr. Starr. You are awesome. I am going to visit the NANDA website and view my book to develop possible nursing diagnoses and care plans for the Hispanic patient in the community.
Jonathan, that is why I am here. Please let me know if I can be of any more assistance. Enjoy your community experience.